Hello, my loves. Welcome back. It's me. Today we are talking about 5 essential exercises that every new mom should try. Now, as a new mom, we know how hard it can be to find time to work out. Finding time for yourself is probably something that's near impossible. But trying to find time to work out and do these 5 exercises will help you recover your core, your pelvic floor, and just help you feel like yourself again. So grab a ball, a mat, and a friend if you want, and let's get started. The first exercise is Kegel exercises. Now, we all know by now that our pelvic floors were greatly affected during pregnancy and after birth. We had a huge baby sitting inside of us and then being pushed out of our bodies. And this puts a lot of pressure on our pelvic floor muscles, which also support our bladder function. The great thing is there are a lot of things that you can do at home to strengthen your pelvic floor without having to go anywhere or really even doing anything too crazy. So one of my favorite exercises to recommend for strengthening the pelvic floor is called Kegel exercises. There are other types of exercises that you can do as well, but Kegel exercises are a safe, effective, and non-invasive way to strengthen those pelvic floor muscles. To learn how to perform a Kegel exercise, lay down on your back with your knees bent and feet flat on the floor. Now, relax your stomach. Tighten your abdominal muscles and slowly raise your hips up off the floor while you're breathing normally. Hold this position for a few seconds and then slowly lower your hips back down to the ground and relax. Now, as you become more comfortable, you can hold for longer periods of time. You can start out by trying to hold for about 3 seconds and then work your way up to about 5 to 10 seconds. You'll definitely be able to tell when you're redoing the exercise correctly because you're going to feel the muscles in your inner thighs and pelvic area working. Once you feel stronger, you can progress to standing Kegels. These are just as effective as lying down Kegels, and they can easily be done while you holding your baby. Start by standing up with your feet shoulder width apart. Hold your baby close and then repeat that same motion, tightening the muscles that you would tighten when you're doing a Kegel. Hold for 3 to 10 seconds, depending on how strong you feel, and then repeat several times. One important tip here is that you want to make sure that you're not clenching your buttocks while you're redoing the Kegel exercise. The Kegel exercise should only be performed with the muscles that you feel in your inner thighs and pelvic area. If you clench your butt cheeks together, you could cause some pelvic floor dysfunction. And so it's really important that you focus on just those pelvic floor muscles when doing Kegel exercises. It is also important to mention here that you should never push or strain to go to the bathroom. Straining to have a bowel movement or push it out can put lots of pressure on your pelvic floor and cause pelvic organ prolapses. Make sure that if you're having difficulty having regular bowel movements, that you're eating lots of fiber and drinking plenty of water. But if you're still struggling, please talk to your healthcare provider about getting a referral to a colorectal surgeon who can help get things moving regularly again. The second exercise is walking. Walking is an excellent exercise to start with if you're feeling overwhelmed and do know where to begin. Taking walks around the block with your baby in the stroller is not only great for you, but also great bonding time with your baby. Another added benefit of going on walks is the natural vitamin D that you're going to get from the sun. And if you live in a cold climate like I do, you can still get some of those benefits by taking your walk outside in the winter months. I try to bundle up as best as I can and still take my walks outside in the winter. And it's honestly not as bad as you think. A good rule of thumb for walking is to try to walk for about 30 minutes at a good pace most days of the week. When you're starting out, though, you may only be able to manage a few minutes at a time. That's okay. Just go at your own pace and do what you can. It's important to listen to your body and stop if you feel dizzy, nauseous, lightheaded, or overheated. The third exercise is the pelvic tilt. Pelvic tilts are great for spinal health, especially after pregnancy and delivery. Pregnancy causes a lot of pressure on the spine, especially in the lower back area. And sometimes we spend way too much time sitting. This can cause your spine to stay in a flexed position for too long, which can contribute to back pain. Pelvic tilts are also great for improving posture. So stand up straight with your feet shoulder width apart. Slowly arch your back by tilting your pelvis backwards. You should feel a stretch in your lower back. Hold this position for a few seconds and then drop your lower back down and relax. Repeat this motion for about 10 to 15 repetitions, and you can do these pretty much anywhere. So whenever you find yourself sitting for too long, whether you're at work or at home, you can sneak in a few pelvic tilts. No. 4 is belly breathing. Now, belly breathing is a great exercise for getting your core and pelvic floor muscles working again. It's also a good way to reduce stress and anxiety. Now, belly breathing can be done anywhere, anytime, and it's great to do before other exercises to warm up your core muscles. So you want to start by laying down on your back with your knees bent and feet flat on the floor. Now place a ball or a towel on your stomach, and then slowly take a deep breath in through your nose. As you inhale, you should feel your stomach rising. Then breathe out through your mouth and feel your stomach falling. Now try to do about 10 to 15 of these breaths, and you can increase that number as you become stronger. As I mentioned, you can do this anywhere, anytime. So if you find yourself stressed out or anxious, take a few moments to practice some belly breaths. This can be done sitting up in a chair, standing in line at the grocery store, and can help you calm down when you're feeling overwhelmed. The fifth exercise is squats. Squats are another great exercise for strengthening your legs and your core. Squats can be done pretty much anywhere, and you can add weights once you become stronger. Squats are also great for strengthening your glutes, which are often underworked and underdeveloped for most people. So start by standing with your feet shoulder width apart. Slowly lower your body down into a squat position. Hold for a few seconds and then stand back up and repeat. You can add weights as you get stronger. And like I said, you can do these pretty much anywhere. I like to do squats while I'm brushing my teeth or waiting for my coffee to brew in the morning. So there you have it, 5 easy exercises that you can do as a new mom to help strengthen your core and pelvic floor. Now remember, you don't have to do all of these exercises at once. In fact, it's probably best to start with just 1 or 2 and then work your way up to the others. Listen to your body and don't push yourself too hard. And always make sure to talk to your doctor before starting any new exercise program. If you're enjoying the content, please make sure to share it with your friends. And as always, thank you for watching.